It's great to be back here again. I promise next year I'll buy a different sport coat, or I have washed these clothes since last year, so don't be afraid to hug. So I wanted to reflect on a couple of things that you were talking about. One is survivorship, and the other is this 2-mile walk concept for Raleigh. So I have a couple of patients who are, long-term survivors now with all the advances that we've seen in lung cancer treatment. It's fantastic. It's amazing to have these people. I have 4 in particular that come to mind that are these amazing athletes, 2 triathletes, marathon runner, and long-distance cyclist, and they have just been, going strong, doing incredibly well. So Rob comes with me to the Greensboro 5K, and so I think the first was about 3 years ago that he came along, and he just left me in the dust. This guy's an amazing runner. He'd been through a rough patch, right? I mean, he had problems with his lungs, and he just kind of left me in the dust. It was a very proud moment as an oncologist. So after 3 years of him leaving me in the dust, that feeling has sort of given way to insecurity and jealousy on my part. So I think I'm going to bring him to the 2-mile walk and walk him into the ground this year. So you can, next time you see Ron, Emily, you can tell him, or Rob, tell Rob that I'm coming. So survivorship is an amazing part of the discipline now. We do have to attend to the needs of survivors, and our survivors are as diverse as the diseases that we're treating. So a lot of people, when they hear lung cancer, they sort of think of one disease. I was giving a talk this year on small cell, pointed out how it was an orphan disease because it's a rare, uncommon subtype. The truth is, lung cancer has become this collection of rare diseases. Every person speaking at the research conference was speaking on a rare disease, some specific version, either immunosensitive, high PD-L1, EGFR, ALK, ROS, all these different things that we as researchers have had to learn to recognize and go after and study. And so it's great to have more and more survivors at the races, even if they do make me feel a little bad about myself at times. So the reason for the drop in annual mortality is an interesting topic. As Jennifer mentioned, the American Cancer Society has just released that this was sort of, most recent data shows the largest single-year drop in lung cancer mortality ever, which is something to celebrate. And the reasons for that are a couple-fold. So this was a drug development sort of conference. That was what it was oriented around. But we had a speaker from the American Cancer Society who came and pointed out, yes, the medications that we're giving are making a difference. That's true. The other thing that's making a difference is early detection, and I think it was unmistakable when you looked at the data that he presented, that clearly we're finding more early stage lung cancer now than we used to because of screening, and we're still not doing enough with screening. All the work that you're doing as a group to get the word out about getting screened, early detection, getting it out not just to the patients, but also to the providers, is hugely important. I think the medications have made a difference as well, and today I'm going to review a couple of the projects, sort of give you sort of brief summaries. The things to know are, finding cancer early and keeping it from spreading, really important. And the next is that these new treatments, particularly the immune treatments, seem to be giving some signals of very long responses. So that's sort of the brief overview. So with that, So Emily Harrison, who I had gotten to meet once before, I think at this event, maybe 2 years ago, as a fellow, has been selected for the first independently funded career development award from LCI. And yeah, round of applause for Emily. So congratulations. At UNC, a lot of the research has been focused on, I mentioned, it's a collection of rare diseases. There have been a lot of advances for adenocarcinomas of the lung. Advances for squamous cell cancers have been slower to come around. And it takes real work and diligence to develop the science that we need to have the drugs that we need to more effectively eradicate that particular type of cancer. And so under, I think, partially Chad's tutelage, but they have really developed critical mass as a research group around this topic, and Emily is taking that the next step. So she studied some work in signaling between cancer cells and normal cells, these things called chemokines in the past were something that she had studied. She's now studying how nerve cells may actually interact with cancer to promote the spread through specific chemicals. And some of those chemicals already have new sort of druggable targets identified where a medication could be developed potentially to stop a cancer from spreading in the first place. Okay, so that would be another huge step in this ongoing decline in lung cancer mortality. And she's clearly a committed scientist and is rock solid in the lung cancer space, and we love to see that. So congratulations, Emily. And the next researcher to review is Ken Adler. And I don't know if Ken is here tonight. If he has, he's not able to make it. Okay. So we talk about several different institutions in the state. The truth is there are a huge number of educational institutions across the state with people doing research in a number of different areas. And so we want not just the big medical schools doing lung cancer research, we want all that brain power going towards lung cancer research, right? And there's some pretty amazing brain power at NC State. So Ken Adler actually has been studying lung cancer for a while. This is not his first foray, but this is his first grant from LCI. So I guess round of applause for Ken. He's also working on sort of novel targets for lung cancer treatment, and some of the targets that he's identified already do have drugs, and some of those have already gone through some level of clinical testing. So his work is actually very close to making an impact on people, and I think that'll be exciting as a group to kind of see, funded research and a person impacted directly by a discovery that's gone from the bench to the bedside right here in North Carolina. So it's exciting. Dr. Du is at University of North Carolina, and I mentioned that they have a lot of interest in CAR T cells, or in squamous cell, and this concept of chemokine signaling. So there are certain chemicals that can kind of attract cancer to grow, and there's the potential to use some of these immunotherapy treatments to target specific places in the body. So the CAR T cells are a specific type of an immune treatment, and trying to get those where they need to go is an important part of getting them to attack the cancer cells. They can't attack a cancer cell if they're nowhere near it. So his work is going to be focusing on immunotherapy for brain metastases. And this can be a real big challenge in the clinic, and we need to have better treatments for that, medical treatments that don't involve something that is really hard on people, whole brain radiation. And hopefully, by understanding how to get the immune cells where they need to go, we can help develop sort of better immune attack of brain cancer. Does that make sense? All right, excellent. Here with us is Dr. Dr. Du here tonight? Okay, all right, sorry. I don't mean to just highlight people that aren't here to make them feel bad. I haven't met everyone, so. Dr. Woodcock, so I'll start by asking, are you here today? Okay. Great to have you. If you could stand and be recognized. Congratulations. So Dr. Woodcock is going to be looking at a large database of immune signatures to help us better identify who are the patients who are going to derive the most benefits from these immune treatments. So we have a couple of different immune treatments available to us, and we have this group of patients that responds extremely well and lives for a really long time. And we've only started to crack the surface on who those people are. So if we can figure out who those people are and why their cancers behave the way that they do with these treatments, we can better understand how to make the treatments better for the other folks, right? So that by understanding this sort of piece of biology and molecularly, on a sort of molecular level, who are these people and defining them, there's a real possibility that we'll be able to make better advances both for selecting treatment and then identifying why are some people not responding, what are some of these resistance pathways. So there are a couple major lessons that we hope to learn about from your work, Mark. So no pressure, but it's exciting to have you as one of our fellows, and as you can see here, so we for the first time decided to have sort of a special recognition for one of the awards, and your grant application was impressed the committee with this, and so congratulations on being the outstanding fellow this year. Dr. Dory, is he here tonight?
He was. He had to leave early.
Oh, okay.
He had an all-nighter last night.
He had an all-nighter last night. All right. So Dr. Dory is studying the concept of lymphocyte exhaustion. So, so the immune system, I joke with people that I used to think that the immune system, like most doctors, that the immune system was never really going to work. To start with, there was a lot of nihilism for a long time. Neil and I were just talking about this, how Scott Antonio used to get sort of made fun of because he was studying the immune system, and now it's become this huge topic. So, but I've learned some things, so I'll try to share some of the things I've learned. So you have these cells. So we talked about these CAR T cells and trying to get them where they need to go. So those are lymphocytes, and some of those, if you can get good lymphocytes where you want them to be, and they're ready to go, and they recognize the cancer, boom, they'll kill it. One of the great things about the immune system is, just like when you take a vaccine, you can teach your immune system to get better at killing something, right? That's basically what we're doing with vaccines. So give someone a flu shot, and then later on, if they get the flu, their immune system is primed and ready to go. So that's what we call sort of a memory response to the immune system. So it sees something that it's supposed to recognize, and then those cells, they build a memory function. They survive, and they grow, and they are even, you have even more cells that are prepared and ready to attack. Right? That's what you want to have happen. But something else can happen in cancer. It's a problem. It's called T-cell exhaustion, where instead of going back and learning more and getting better, more and more effective at attacking the cancer cells, some of those cells that should be forming the memory actually die, and that's a bad thing. If we can understand how to keep that from happening, it's possible that some of these long-lasting immune responses could last even longer than they are right now. If we can get those good cells, instead of dying off after they attack the cancer cell, to actually form this kind of memory function and do what we want them to do. So there's a lot of biology that goes into how that happens, and he's studying pleural effusions from lung cancer patients, which is a very fruitful path for research. So, cool. Dr. Sheila is going to be studying the antibody markers for patients in lung cancer cohort. for high-risk smokers. So is Dr. Sheila here with us? All right, Dr. Sheila, welcome. So, lung cancer screening is very important. I talked about the American Cancer Society, and we're talking about medications and how we're doing good things with those, and that's true. We are doing some really good things with those. I think, Neil, I don't know if you were impressed with this or not, but at the Santa Monica meeting, I thought everything was going to be about that part of it. And clearly the guy from the American Cancer Society said, yes, that's great. We're doing a lot with medications, but don't ignore this curve. I think he kind of brought us back and reminded us, part of this drop in mortality is that we are catching lung cancers early. We're doing a better job finding stage 1 cancers, getting patients to the operating room, whatever they need to get rid of the cancer before it spreads. And so it's very important that we're meeting that part of the research goal, in addition to the education, that we're finding better ways to detect lung cancers early. And her project is focusing on high-risk patients and finding other ways to sort of detect lung cancers early so that patients can be cured. So I hope that's so thank you and congratulations. So, and is Dr. Johnson here with us? All right. Congratulations. And so she's going to be studying patterns of care delivery. So we talked about trying to educate physicians. I think that's an important topic because as advances happen in the lung cancer field, it requires a lot of effort to sort of understand what the latest and greatest treatments are, to put those things into practice quickly, and but not too quickly, to match the right treatment to the right patient. It takes a lot of time, and so understanding how care is delivered across multiple health systems can give us some insights into educational opportunities for physicians and help us to understand what things are happening, not just in sort of major academic centers, but out in the community, so it can be better prepared to educate and find out what barriers there exist. So sometimes there may be educational barriers that exist in a small community practice, and sometimes there may be other barriers, travel barriers or financial barriers, and a lot of the things that you're funding as an organization, you can only attack if you know what the barriers are. So excited to see what you learned in your project, and congratulations. And then Ryan Hughes. So Ryan, I know you're here. So Ryan is being mentored by Dr. Bishop, who has also been funded through LCI, and Ryan is a radiation oncologist who's finishing up his residency and will be staying on as faculty next year, and we're really excited to have you in the radiation oncology division. Not that I'm in the radiation, but I'll work with them all the time, so I'm in the medical oncology division, but I'm still excited. So Ryan is going to be studying pneumonitis. So one of the problems with the immune treatments, they could do a lot of good for a lot of people, but there are also some really tough side effects from all of these different medications, and particularly with the immune therapies, you can get inflammation in the lungs. And as many, we're helping a lot of people, but every now and then there'll be someone who's really severely injured, and there have been people who've even died from this side effect of a treatment. So we want to find a way to catch that as it's happening before it turns into a really severe state. And so that Dr. Bishop has a technology for looking at breath. I think we talked about it as sort of an early detection strategy for finding whether or not lung cancer exists. But the other thing that could be done is to try to detect inflammation in the lungs before it becomes symptomatic. And so Ryan is going to be looking in patients who receive these immune treatments and radiation treatments to try to predict who's going to get this side effect, so we can try to intervene earlier and keep it from being so severe. So, Ryan, congratulations. So, that's it for my part. Thank you guys, and I'll turn it back over to you.
Thank you. Thank you so much, Dr. Petty. That was a great summary. And if anybody has questions of Dr. Petty or the research fellows that are here tonight, please don't hesitate to stop them on the way out tonight. You do have their names and their areas of focus listed in your program as well. But thank you again.